This is one of our microscopes we have here at the hospital that I work at. We have a couple, we have two in here and then one in the back. So for your microscopes, they're fairly easy to care for. You're going to have replacement bulbs for them, and you're also going to have a cover for them, so when they're not in use, they should be covered at the end of the day or anything like that. You're always supposed to cover them up. There's a couple different things that you need to remember with the microscopes is when you're getting, let's say, a brand new microscope, you're going to have to calibrate the lenses to what type of testing you're going to be doing. The stage micrometer, you can buy one, but if you only have 1 to 2 microscopes and you're not going to be having a bunch of different microscopes, it's usually better to borrow one from a university or any other type of laboratory diagnostics area. And then you always want to have just some Kimtech wipes available. That way when you're done using, say, an oil immersion slide, you can always clean your lens after use. Always wipe off the lenses after you're done using them. When you're done using your microscope, you always want to put your stage back in the most downright position, and always make sure your objective lenses are normally starting off on the 4 times power and not halfway in between them or anything like that. And again, just at the end of the day, you want to take your microscope cover and just kind of slide it over that, and that's just going to kind of help protect dust accumulation or anything like that. Your microscope should be stored in an area where there's not excessive heat or excessive water that could possibly be spilt on it. And also, when you are done with your microscope, you're going to always remember to turn the light off, and if you ever have to replace the bulbs in your microscope or anything like that, you always want to turn the lights off, unplug it, wait for the bulb to cool down, and then replace it with the exact same type of bulb that would originally come with the microscope. And try not to touch the replacement bulb with your fingers. The oils off of your fingers can shorten the life of that replacement bulb. So today we are going to be running a 40x snap test. The tests come in boxes with tests prepackaged like this. Every box of tests has their own bottle of conjugate. Even if you have conjugate left over after the box of tests is finished, you still want to discard this conjugate. You aren't supposed to use it with any other tests at all. This 40x snap test is going to test for heartworms, Ehrlichia, anaplasmosis, and Lyme's disease. So we're going to go ahead and start that. And these tests come with their own little pipette that you're going to use to add in your blood drops into. So the front of the test looks like this. There is one control dot that is going to come up whether your test is positive or negative. That's your control. And then these other dots will show up depending on what the animal is positive for. So right now I'm going to take some blood from an ED tape triple top tube, and I'm just going to invert it a couple times just to make sure everything's nice and mixed up. And I'm going to be adding 3 drops of this into this little container right here. So I'm going to open my container and I'm going to place it right over here so you'll be able to see. I'm going to take off my tube top, set that aside. Using the enclosed pipette, I'm going to aspirate a little bit of blood, and then I'm going to add 3 drops. Alright, I'm going to put my lid back on my tube, set that to the side, and then the conjugate, I'm going to be adding 4 drops of blood, 4 drops of the conjugate. Okay. Put my lid back on my conjugate, set that down, and I'm going to take this, I'm going to close it, I'm going to invert it a couple of times to get everything nice and mixed. Alright. So then I'm going to dump the entire contents of this little tube into my test well right here. And then I'm going to wait for the blood is going to run down this window. And then once it appears or starts to show up in this little activation window right here, I'm going to snap it down and we will wait for 10 minutes and then the test results will be ready to read. So our blood has made it to our activation window, so we're going to snap this down. And then I'm going to write the time, 11:34, so this test will be ready at 11:44. Alright, so right now we're getting ready to do a modified knots test. This test is used in conjunction with a just direct blood smear while you're looking for heartworms. This test is going to help you tell the difference between the D. immitis and the Vthtavma larvae that you might see on just a direct blood smear. Alright, so I have my centrifuge tube here, and I already have an appropriate counterweight in my centrifuge waiting. So is what we're going to go ahead and do is we're going to take a milliliter of blood and then 9 milliliters of a 2% formalin mix. So we're going to go ahead and just add our milliliter of blood, right? And then we're going to add 9 milliliters of the 2% formalin mix. So we're starting off with the 10 milliliter line, so I'm going to add until we hit the 1 milliliter line. Alright. So we added our 9 milliliters of 2% formula mix. And right now we're just kind of going to gently invert it a couple times to mix everything. Okay. So, take my gloves off. Then we are going to add it directly across from our appropriate counterweight. We're going to close our lid. And we are going to centrifuge this at 1500 RPM for 5 minutes. And we're going to start, and we'll be right back when this is done centrifuging. Alright, so our centrifuge is done spinning. So I'm going to take my sample out, and I'm going to decant the supernet that is on top. I'm going to make sure not to disturb the the pellet of erythrocytes at the bottom. So I'm going to go ahead and take this out, and this is what it looks like right now. So I'm going to come over here. Alright, so I've decanted my supernet from the top, and now I'm going to place 1 to 2 drops of new methylene blue dye. I'm going to be using a pipette to do that. I'm just going to get my little pipette. And now this is 2.5% new methylene blue. So I've placed my drops in there. I'm going to just mix it a little bit here off to the side. So after I have mixed, I'm going to add a drop of this to my slide, and then we are going to put a cover slip on this real quickly. I'm going to take it to the microscope and look at it underneath the microscope. Alright, so right now we're at the microscope. We're going to look at our blood for the modified knots test underneath the microscope. And I'm going to start by just placing my slide on the stage of the microscope. Right now I am on a 4x objective lens, so I'm just going to adjust my eyepieces here so I can see. And I'm going to lower my light down just a little bit. And I'm going to go ahead and focus in on my slide. Alright, So once you're all focused in on your 4 times objective lens, which would be 40, you're going to go ahead and move to your 10 times objective lens. Okay. And then again, just go ahead and focus in. So once you've focused in on your 100 times objective lens, you can start moving the slide around, and you can begin looking for any microfilaria that you might see on your slide. So I'm not seeing anything right now. I would be looking for any type of microfilaria on here. One of the reasons why we do the modified knots test is that microfilaria, the microfilaria of the D. immitis, which is the heartworm, and then the A. recundum, there's going to be some differences in them on the modified knots test. The D. immitis is going to kind of have a blunter head and then a straighter tail, while the other one is has a actual hooked tail, and that is an artifact from the formulin. Okay, so I didn't actually see any microfilaria on that slide. So from a blood smear perspective, this patient doesn't have any microfilaria in the bloodstream right now. Alright, so right now I'm going to be setting up for a couple different fecal testing methods. The first one is just a normal float, the second one is a centrifuge float, and the third one is a sedimentation, and then our last one is going to be a direct smear. So right now I'm going to set up 3 real quick, and then we'll move on to the direct smear. So I have my sample right here. I'm just going to take out a small amount and place it into each of my cups that I have. Alright. Put a little bit more of my sample in my first and third cup. Okay. So I've got a fairly good sized sample in all my cups. I'll go ahead and put the lid on and save the rest of my fecal matter for my smear. So now I'm going to put some of our fecal sol in each of my cups. Alright. Okay, I got that added. I'm going to take a tongue depressor and just kind of mix up my sample. Alright. So my first sample is mixed. And my second sample here I'm going to go ahead and mix. Alright, so my second sample is mixed. And then my third sample. Alright, and now that is mixed as well. Alright, so I have all 3 of my samples mixed up. Now what we're going to do is transfer them into either a tube that's going to be sitting for a minute or 2 or a centrifuge tube. So I'm going to get a gauze sponge, and this first tube here is going to be centrifuge. So that's going to be my centrifuge fecal float. So I'm going to, your gauze sponge is pretty much acting like a strainer. It's going to help keep all the larger chunks out of your sample. So right now we're just going to head and add our sample into my cup over here. leaving a small space at the top. And I'm going to go ahead and grab a new gauze sponge and do the same thing for my second and third samples. Okay. So, going to go ahead and fill this one up again, about to the top, because that's going to be my float. And then I'm going to go ahead and fill this one up almost to the top, because this is going to be one that is centrifuge. So I'm going to leave a small area at the top. And I'll just go ahead and fill that up. I'll stop right about there. Now I'm going to put the lid on my first tube, because this is going to be centrifuged. And then I'm going to put the lid on my second tube as well, because this is also going to be centrifuged. And move them to the back. And I'm going to clean this up real quick, and then we'll put these in the centrifuge, so I will be right back. So I still have all my samples here. For this sample here, we're going to just do the fecal float. So what I'm going to do now is I'm going to add a cover slip on top, and I'm going to allow that to sit. And then for these two back here, these are going to be my centrifuged float and my sedimentation. So I'm going to place these both in the centrifuge on opposite ends, and I'm going to centrifuge them for about 5 minutes. I'm going to close my centrifuge, and I'm going to start that. And while that is centrifuging, I'm going to go ahead and just gently slide that back. And I'm going to do a direct smear. Slide this back a little bit more. So with my direct smear, so right now we are going to go ahead and do the setup for our direct smear. So right now is what I'm going to do is this is just some sterile saline. I'm going to add a couple drops of the sterile saline to my slide right here. So I've just added a couple drops of the sterile saline. Set my slide down really quickly. And I'm just going to contain a small amount of fecal matter on the end of my applicator stick. There's some hair in here. So I've got a small amount of fecal matter on the end of my applicator stick. Just going to dab some of that on there. And then, so my smear does not get too thick, I'm going to use a different applicator stick. And I'm just going to kind of mix it around. And then I'm going to just kind of smear it across, making sure it's not too thick. And then I'm going to grab a cover slip, and I would put a cover slip on top of that, and then I would take that over to the microscope, and that is what I would read. Alright, and since my other two fecals are done spinning, I'm going to go ahead and take them out and place them in here. Alright, so for this one we were going to go ahead and just have this one be my fecal float. So again, or not the fecal float, the fecal centrifuge. I'm just going to set that in the back. I'm going to add a small amount more of my fecal salt until it forms a small meniscus on the top. I would grab a cover slide and go ahead and place that on there, and that would be my fecal centrifuge. For the fecal sedimentation, I would go ahead and pour off the top remaining part, trying not to disturb any of the sediment in the bottom of it. set that back down. And then using a pipette, you would go ahead and just obtain a small sample from the bottom and put that on your slide, placing a microscope slide over that. And this would be your fecal sedimentation. Now your fecal sedimentation would be used to look for parasites that are normally too heavy to float. We're going to collect a free catch urine sample. This is normally done in the mornings. This is going to be midstream. So your animal is going to begin to urinate, and then you're going to collect your sample. And you're going to try not to touch your patient after you collect your sample. We normally do this in the morning. That's when the urine is going to be a little more concentrated. And the reason we're doing a midstream catch is we're giving a chance for the urethra to flush out any epithelial cells or anything like that. So right now we are doing urinary collection by cystocentesis. We're doing an ultrasound guided cystocentesis. This is going to help guide the needle cleanly into the bladder. This type of urinary collection is good for urine culture and sensitivity send-outs. So right now she's just poking into the abdominal muscles through the wall, and she is again using the ultrasound to guide her needle into the bladder. And she's aspirating urine right now, and then once she's done aspirating the urine, she will take pressure off of the plunger and withdraw her needle. And she was using a 3 milliliter syringe with a 22 gauge needle that's 1.5 inches long.
You good, buddy.
Right now I'm getting ready to place a red rubber catheter in a male dog. We're going to collect some urine where my catheter really needs to go. So we're going to measure pretty much just around here and right about till we would be up into the bladder. So this is a 8 French urinary catheter, red rubber, and this is going to be sufficient enough for us to get into the urinary bladder and get a urine sample off of him. Alright, so right now I have everything set up for my urinary catheter. I've got some gauze soaked chlorhexidines right there. I've got 2 syringes, one that I'm going to use to empty this bladder with, and the other one I'm going to collect the first few milliliters and discard that. I've got some sterile saline wash underneath those. I've got my red rubber catheter right there. I've got both of my gloves, and then I've got some sterile surgical lubricant here that I'm going to open up, and I'm just going to place right there real quick. Alright, so I've got my patient in the trough right now. I'm going to go ahead and put my gloves on. To keep my gloves mostly sterile, I'm going to just touch the inside and outside part of my gloves right now with my unsterile hand. And then same thing with my other glove. Going to be touching, so with this one I'm going to touch the inside part of my glove because this glove is sterile. There's my thumb. Alright, and then so I've got all my gloves sterilely on. I've got the sterile lube. I've got my sterile lube, sterile gauge, sterile syringes, and sterile saline to wash, and this is my red rubber catheter. So I'm going to have them extrude the penis for me. Alright, so I'm just going to gently clean off the outside of the penis with the chlorhexidine gauze real quick. This is so we don't add any other bacteria into our urethra or anything like that. I'm going to take my sterile saline and just kind of wash my area a little bit. Alright. Come over here. Now this is the sterile lube. I'm going to put the sterile lube on my urinary catheter tip. Scoop out. And then I'm going to just insert my catheter into the penis. Can you see, Gage?
Yes.
So I am advancing down the urethra up into the bladder. I'm going slow so I don't cause a lot of irritation. We're going to discard the first few milliliters of urine just because there's going to be some extra epithelial cells in this urine sample. So I'm just going to let the first couple milliliters of that kind of drain out. Advance a little bit further in. I'm going to just pee this out.
He's trying to, yeah.
Oh, he's trying to go. He's got to go. So I'm just aspirating my sample really quickly. All right, Paige, pause. So right now we're going to be going ahead and getting an ear cytology for my friend here. Ear cytologies are used to look at any bacterial growth in the ears. A lot of times the patients will present with ear shaking, ear itching, either a very purulent kind of discharge coming from the ears or a very odd smell, kind of yeasty smell coming from the ears. So with my first Q-tip, I'm going to go ahead and get a sample from the left ear. We're going to go ahead and just kind of open up the ear a little bit so I can get down into the ear canal slightly. Just kind of clean it out just a little bit. And because this was our left ear, I'm going to bend the tip of my Q-tip to make an L. And then we're going to go ahead and do the right. So pretty much same thing for the right ear. Going to just kind of open up my ear just a little bit. Swab around down in there. And we're just doing both ears to make sure that... Alright, so right now we have our swabs from our ear cytology. So for the left ear, I'm going to swab this closest to my frosted edge here on my slide. So I'm just going to gently roll the swab over the slide. I'm not going to re-roll in any area. Anytime I move my Q-tip down, I'm going to make a new roll. I'm not going to go back and forth over the same area. And then for the right ear, I'm going to do it at the furthest end of my slide, away from my frosted edge. Again, I'm just going to gently roll my Q-tip down, not going over the same area twice with my Q-tip. And I'm just going to let these air dry for a little bit, and then I will be back to stain them. Alright, so right now our ear cytology is completely dry, so we're going to go ahead and stain it. So I'm going to place my ear cytology and my first stain here. I'm going to leave that sitting there for about 10 seconds. And I'm going to go ahead and take it out, give it a little dab, place it in my second stain for about 10 seconds. And once that's done, I'll take that out, put that in my third stain for about 10 seconds, and then I'm going to just cut on some water real quick to wash the back of my slide. Alright, so it's been about 10 seconds. I'm going to go ahead and just dab that off a little bit. And I'm going to wash the back of my slide off. Okay. And I'm just going to go ahead and set that there. And I'm going to allow that to dry. Alright, so our ear cytology is completely dry. We're going to go ahead and add our ear cytology to the microscope stage. And we're just going to go ahead and focus in, and we are on the leftmost side of my slide here. So we're going to go ahead and focus in just till we see some color. Alright, and we are on a 40 times objective lens. So we're going to go up to a 10 times objective lens. We are on the leftmost side of the slide here, so this is our left ear. Alright, and then we can go ahead and move up to a higher objective lens. Now, again, this particular microscope has a oil immersion, so we can use our immersion oil on our 40 objective lens. That is not the case with most slides, but with this slide, we use we can use immersion oil with our 40 objective lens. So we're going to go ahead and move my 400 objective lens, I do apologize, on. We are going to go ahead and just go ahead and just focus in. And when we've focused in, again, we can go up higher to our 100 times objective lens and focus in. I am not seeing anything out of the ordinary with these ears. There are the occasional what looks like to be yeasts. They're not numerous in count at all for our left ear. Okay, so we're going to go ahead and slide over to the right portion of our slide, and I'm just going to place a small drop of immersion oil on our right portion of our slide. Okay. Alright, so again, I'm on the right portion of our slide, which is going to be the right ear. And again, I'm not really seeing too much going on in this ear. We do have the occasional, again, yeast, but they are not numerous in any way, shape, or form. Alright, so just the occasional yeast for both of these. So right now I'm going to kind of show you how we would get our sample for a fungal testing. Normally your patients would present with sort of maybe like a ring-like lesion on their back that is kind of scabbed over just a little. So that circular lesion that some patients do present with is a telltale sign of a ringworm. Ringworm is a type of fungus that animals and humans can both get, so you always want to wear protective gloves or a lab coat while you're doing any type of dermatological or fungal testing with any type of patient. So normally you have two different types of DTM trays. This is not a tray, this is a circular one. There are circular trays as well. Those ones work really well with like a toothbrush. You can do a toothbrush scraping where you're going to kind of hold the skin back and scrape the toothbrush against the fur growth. Normally about 30 brushes is sufficient enough to collect a good sample of the skin. And you can also pluck some of the hairs, about 20 to 30 hairs with a pair of hemostats. If you're going to be plucking your hairs, you want to push them down into the medium to kind of inoculate the medium, but you don't want to bury them. So right now is what I'm going to do is I'm going to go ahead and just pluck a couple hairs off of Rudy here, and I'm going to push them down into this medium. Okay? So I have my sample jar open. He's kind of missing a little hair right here. So right now, I'm just going to grab a small sample of hairs. Okay, I'm going to pluck them out, like so. I'm going to push them kind of down into my medium and just kind of inoculate my medium with those hairs. Now I'm going to go ahead and do just one more sample, just kind of in a different little area. Go right here. Alright, so I'm going to go ahead and pull back. Sorry, honey. So I have my hairs right there, and again, I'm going to push that down into my medium, just to inoculate my medium with those hairs. And then I'm going to close this lid, but not too tight. And I would put this in one of our cabinets to let it sit at room temperature, and I would check this daily for any colony growth or anything like that. Alright, so normally you would want to check on your colony about every day for 10 days. A lot of times you can see a color change right here in the medium. That is not always a positive, so you always want to check your colony underneath a microscope as well. So is what you're going to do is you would take a piece of tape. Now, of course, this is going to be a lot easier with a actual plate. You're going to take a piece of tape and just gently into the medium. You would push your tape, bring your tape back out. All right. And we're going to go ahead and we're going to come over here and are going to stain our tape. So we're just going to dip it in our fixative for about 10 seconds. Okay. And then our second stain for about 10 seconds. Okay. And then the third stain for about 10 seconds. And I'm going to go ahead and just wash my tape off. Put our tape onto a slide like that, and we're going to go ahead and let that dry for a couple minutes. So my dermatologic testing slide is done drying. I'm just going to go ahead and set that on the microscope stage. I'm going to adjust my eyepieces here so I can see. So right now what we are looking for is any kind of bacteria shaped, kind of like a canoe, or that's what we would be looking for, is bacteria shaped kind of like any type of canoe, or any colonies of bacteria that are going to be growing culture medium in there. Overgrowth of any type of bacteria at all on this slide. Pause. So right now we're getting ready to do a skin scrape. There's two different types of skin scrapes you can do. You can do a deep skin scrape, and for that you're going to kind of want to shave the area that you're scraping. You're going to do a skin scrape with any animal presenting with alopecia or any pustules or anything like that. The deep skin scrape is going to, you're going to scrape the skin deep just until a little bit of the capillary blood kind of oozes up, and that's going to be your sample. The reason we do a deep skin scraping is to look for any type of Demodex mite or anything like that that can cause mange. A superficial or light skin scraping is going to look for any of those mites or lices that are going to live on the hair follicles. So you don't necessarily need to shave the area, and you don't need to do a deep scrape. Just a couple scrapes with your scalpel blade will be enough. So right now is what we have is we have a number 10 scalpel blade, some mineral oil. So I'm just going to put a little bit of mineral oil on my slide here. And then after I do that, I'm going to just kind of dip my blade in my oil like that. And we'll be right back when I have the patient. Now we're going to go ahead and do just a superficial skin scraping. You can always take just a little bit of alcohol to kind of clear away any dead skin or debris or anything like that. You want to be careful kind of how you hold your scalpel blade. If it's held improperly, you can risk making an incision rather than just a scrape. So I'm going to scrape this area right here, and again, I'm not doing a deep scraping at all. I'm just going to kind of hold it at an oblique angle and scrape like this. Alright, and I'm going to kind of wipe that. So I got a little bit, but we're going to go ahead and just do another scrape real quick. So again, holding at not an angle like this, but more of an oblique angle. Just go ahead and do like that. Alright, so we've got our skin scraping, and I just went ahead and I covered it with a cover slide real quick. We're going to take a look under the microscope at what we have. Go up an objective lens, and again refocus in. There we go. So you're just going to kind of take a look around and see if you can't see any mites or lice or anything like that that would be living in the superficial layer of the skin or on the hair follicles or anything like that. And right now I'm not seeing any mites or anything like that on this slide anywhere. Alright, so no mites are seen on this slide. So right now I'm getting ready to assist with the necropsy. Alright, so right now we are getting ready for our necropsy, and we are wearing our personal protective equipment. Alright, so I'm opening everything.
Yeah, alright, so
Fine.
alright, so external exam. So this is a 1-day-old C-section puppy that had passed away. Looks to be female, actually male, sorry, male. Basically looking on the outside, looking for any abrasions. This puppy's been in the freezer for quite some time, so devitalization's probably going to be a little bit higher. Got a little bit of blood coming from the nostrils. Don't know if we had some issues with, got some kind of clot that formed to the lungs and maybe didn't allow them to breathe any. No palate holes, no anything, no abrasions, nothing to see on the outside exam. We still got a little bit of the umbilicus here too. But we can cut in, making a midline incision down to the thoracic and abdominal cavity. So make a midline incision right down the chest and into the abdomen. Try not to cut in any of the organs. Okay. So here, this is our intestines coming out. We've got pieces of our liver. So on the bowel, got the stomach, up to the duodenum. There's a small pancreas. Pancreas is a little black and bruised. That could just be from when he's just being a baby. And being in the freezer. Come down into our jejunum, which all looks healthy. And then into our ileum, which is right here, into our colon, and there's our cecum. Okay, so what we can do is take some samples. I'm going to take a piece of our liver here. We'll take that and put it in a formalin jar. Okay. And then here's our kidney. Take a piece of our kidney. There we go. Okay.
Alright, so now that we are done with our necropsy, I'm going to go ahead and label these biopsy jars. This was our first biopsy that we took. That came from the liver, so I would write the patient's name. So it's just really going to be Pup. Today's date. Pup's date of birth. Species. And the doctor requesting the biopsy. And there's that first one. And then again, this is a biopsy of the kidney. So Pup, today's date, Pup's date of birth, species, and the doctor requesting. And I've put kidney on this one, and then I will put liver on that one. Reasons why we would perform a necropsy: if an otherwise healthy animal died under suspicious conditions, looking for any type of embolisms or cancer or anything like that. These would all be reasons that the owners or clients would request a necropsy. Suspect handling, the only people that should be handling a rabies suspect is someone that has had a rabies vaccine. The vaccine is a 3-series vaccine, so you go in 3 times to receive the vaccine, and then you do a titer for that vaccine yearly. So the only person that should be handling a rabies suspect is someone, again, that has received all 3 boosters of that vaccine and has had a recent titer done. The protective equipment is, of course, going to be your gloves, extra blankets or padding, have a catch pole nearby if you might need one, or a catch net if you need one. After the animal is humanely euthanized, in the state of Virginia, we call animal control, whichever animal control office is in charge of that particular county or area will come and collect the animal, and they do the testing, they do the decapitation, and they report their results. We are going to get a vaginal cytology. This would aid in figuring out which stage of heat this dog is. Just going to kind of part up my chlorhexidine soaked gauzes right here, like that. And I'm going to go ahead and open up my sterile Q-tips right here, and I'm just going to hold the ends of them so they stay inside the plastic that they are wrapped in, and I'm going to soak them with the sterile saline that I have, and those are just going to lay right there so I can have easy access to them. Alright, so after exposing her vulva, I'm just going to gently cleanse the area so I don't cause any irritation or anything like that. I'm going to use new gauze squares as I need to, so I'm not recontaminating her vulva or anything like that. I'm trying to get off all of the dead epithelial cells and bacteria and anything like that. Alright, so now I'm going to take some sterile saline. I'm just going to gently kind of wash the area. I know it's cold, honey. Good girl. So after we gently wash the area, I'm going to take one of my sterile Q-tips that have been pre-moistened with some sterile saline. So when I insert the sterile Q-tip into her vulva, I'm going to insert up vertically and then horizontally, so I'm in her vaginal canal. So I'm going to insert up. It's okay, Mama. Insert up, and then
It's alright.
easy,
You're
honey.
alright.
I know.
Good girl. Good girl, Miley. Good girl.
I'm going to gently
Good
roll.
girl. Good
Try and collect
girl.
my
Good
sample.
girl.
Okay, good girl. So I've collected my sample here. I have a slide right here. So what I'm going to do is just gently roll my Q-tip on, and I'm going to air dry, and then I will stain it and take a look at it underneath the microscope. So right now we're going to go ahead and we're going to stain our vaginal cytology. I have 3 different stains right here. The first one I'm going to set my slide in, and I'm going to go ahead and let that just kind of sit there for about, and then I'm going to just kind of dab off any excess, and then I'm going to set it in my second slide, in my second stain, and again I'm just going to go ahead and leave that there for about 10 seconds, and then we're going to just dab off any excess. And my third stain, I'm just going to go ahead and set that in there. And again, I'm going to let that sit in there for about 10 seconds. And we're going to come over here to the water, making sure my top side is up. And I'm just going to rinse off my... Okay. Now that my slide is rinsed, I'm just going to go ahead and set that down and let it dry for about... Alright, so right now I have my vaginal cytology all stained. Ready to go. We're going to place my slide on the microscope. Alright, so again, we're focused in. I can see all my cells. We're going to go up an objective lens, And I'm going to go ahead and get focused on in. Off of the bat, I'm not seeing any red blood cells or anything like that. There are a couple of neutrophils, but not a lot. I'm also seeing the parabasal cells right now. So when you see parabasal cells on your vaginal cytology, this is going to mean that your female dog is in estrus, which is the reproductive system is closed. She is not attracting any male dogs. She is not having any vulva swelling or any type of discharge coming from her vulva. There are several more stages of heat the female dog can go into. Another one is postrus. This is when she is starting to attract male dogs, but she will not accept the male dogs yet. She's having some swelling and some discharge from her vulva. And on the microscopic evaluation of a vaginal cytology, there's also going to be a large number of red blood cells present. Another one of the stages of heat is called estrus. This is also the ovulation stage. This is the stage where she will accept a male dog. She will stand for the coupling and the mating. Her vulva is still slightly swollen, but the discharge has changed from a reddish to a kind of light pink straw color. With estrus, you're going to have the superficial cells, and your neutrophils are going to be absent, and your red blood cells are going to be really minimal. And after your estrus, you're going to have your mestrus cycle. The female is no longer receptive to the male. Her vulva swelling has gone down. She's no longer really having any discharge seen. You're going to see non-cornified squamous cells on your slide. So right now we're going to do a manual cross-match on some blood. So I've gotten all my blood and I've put it in my centrifuge really quickly. So like I said, I've got everything in my centrifuge, and we're going to go ahead and centrifuge it for 5 minutes at 5,000 RPMs, and we'll be back when this is done centrifuging. Alright, so my blood has finished spinning. Right now I'm going to take the serum out of the plain, or my serum separator tubes. I'm going to put those in a plain tube with no additive. So I have, this is my donor blood right here. So I have my tube marked with a D for donor. And I'm just going to get as much as the serum out as I can. Alright, and that was my donor blood right there. And then here on my back side, I have my recipient blood right here. So again, I'm just going to get some of my serum. Alright, again, I have centrifuged my EDTA tubes. We are going to decant my plasma. Alright. There's one. And again, we're going to decant. Alright, and after I have decanted my plasma off of my EDTA tubes, I'm going to take I'm going to start to wash. So with the EDTA tubes, I'm just going to withdraw a small amount of blood. And I'm going to just place 1 to 2 drops in here, this tube that has no additive. And then I'm going to do the same thing for my donor. Alright, so after I have added my cells, I'm going to just go ahead saline. Alright, I'm going to go ahead and place the caps on them like so. And then I'm going to gently invert them a couple times just to make sure everything. To place them in my centrifuge, I'm going to centrifuge them for 60 seconds on 3,400 RPMs. I'm going to do this wash 2 more times with the same samples. Every time they're done spinning, I'm going to decant the supernet off at the top, and I'm going to 2 more times for a total of 3 washes. Alright, so right now we are going to make a erythrocyte suspension. Our red blood cells have been washed about 3 times. I've pipetted off the supernet. So what I'm going to do is I'm going to draw up 0.02 milliliters of my erythrocytes, my washed erythrocytes. And I'm going to place them in a different labeled tube that has nothing added into it. And then I'm going to fill that tube with 0.98 milliliters of sterile saline or NaCl. So now this is what we're going to do. Okay. Alright, so I'm going to just add that to that. I'll recap this needle. Put it back on that and set that to the back. And then I'm going to, again, fill those with 0.98 milliliters of sterile saline or NaCl. So right now we're going to do the major cross match. I'm going to take 2 drops of my recipient serum. Alright, and I'm going to place that in a new labeled tube with no additive. So I've got my 2 drops of my recipient serum, and then I'm going to take 2 drops of my donor's erythrocyte suspension. And I'm going to place 2 drops of that into my major cross match tube. Okay. And now I'm going to set this to the back. Alright, so right now we just did the major cross match, and we have that in a tube in the back here. Now we're going to do the minor cross match. So for the minor cross, so I'm going to place 2 drops of my recipient's erythrocyte suspension in a new labeled tube with no additive in it. So 1, 2 drops of my recipient's erythrocyte suspension. And then I'm going to place 2 drops of my donor's serum in that suspension as well. 1, 2, okay. And then I'm just going to invert that just for a quick minute and set that to the back. Pause. So we've gotten both of our major and minor cross matches in the tube, and now we're going to set up controls. So for the control, you're going to take your both your donor and your recipient, and you're going to label new tubes just as controls. So for the recipient control, I'm adding 2 drops of the erythrocyte suspension from the recipient suspension to the recipient control. And then 2 drops of the recipient serum to the recipient control. Okay. And that is your recipient control. And then for the donor control, I'm going to do the same thing, just with the donor's serum. And we're going to do 2 drops of this in the tube with the 2 drops of the donor's serum. Alright. Now we're going to take both of our controls and both of our cross matches. We are going to gently invert them a couple of times at room temperature for 30 minutes. Alright, so it's been about 30 minutes. Our major and minor cross-match and our controls have been just incubating at room temperature. Centrifuge them down. So, alright, and we will be right back once. So our centrifuge has finished spinning everything down. So I'm just going to kind of tap them, looking for any agulation. Right now I'm not seeing any hemolysis. The controls look about the same. There's no line of agulation or anything like that. Alright, so macroscopically these don't seem to have any agulation or anything like that. So now I'm going to take a small drop out of each tube, the major and the minor, and I'm going to place it on a microscope slide. So we have that on the microscope. Agulation or anything like that. All my red blood cells are evenly dispersed and spaced apart. There's no clumping, nothing like that at all on this major right here. On this slide right here, I don't have any clumps or anything like that. All my red blood cells are. These animals would be a compatible recipient.